pathogenesis. Okay, now the idea is that we've been talking about bacteria generally, been talking about the classification, genetics, and many things are coming up. But by the end of the day, we need to find out how does bacteria cause disease. And again, most of you did write pathogenesis as one of the topics in your presentation. Pathogenesis is a story. If you write in a pathogenesis gamma interferon, TNF, and doesn't make any sense to me, right? So that's fine if it's a talking point, but you need to make sure you expand upon that when you record your stuff. So pathogenesis is a story. You have to tell me the story. How does that particular bacteria cause disease? I'm going to help you today. So maybe it will kind of give you a little bit of understanding. How does bacteria cause disease? Again, it's a mechanism. You know for sure that bacteria is living thing. It needs growth. It needs medium. It's very kind of particular of temperature. And many bacteria have different eating habits, so to speak. Now, one thing you have to understand is that, as you must have figured out, that the optimum temperature that most of the bacteria want to grow is our bodies. So our bodies provide them a perfect niche. So we are their perfect buddies, so to speak. Okay? So we provide them warmth, moisture, and necessary nutrition for growth. So they want to kind of get into stay in our body. They are part of us, and that's called commensal bacteria that I'll cover probably Monday. But the idea is that our bodies provide them a good place for them not only to live, survive, enjoy, so to speak. So they will love to infect us, most of them. Now, they have also acquired genetic traits, as we said. In order for them to come and invade us, they have to pass through barriers. And you know, skin and mucous membranes are barriers, and there are other barriers which are there. So the very first thing they want to do is that they want to come near us, attach to us, pass into us, either blood, tissue, whatever, and then get the entry clearance from our host immune response, fool them, evade them, fight them, whatever they want to do, they have to put up with our immune system. And when our immune system is happy, so do they. So this whole process of any bacteria, for example, I said any bacteria wants to grow on oxygen. So for that bacteria, the best place to go will be lungs, right? And you expire in and out, so this means they really have to adhere, they have to hold on to our body. So they have receptors. So all these things which are there on bacteria will determine what kind of passage do they have in terms of entering our bodies, right? And also, once they enter us, they're going to do what they normally do. They're going to live, divide, produce byproducts like acids and gas and so on and so forth. So this is pretty much there in terms of pathogenesis. And then again, not all of them, many of them in the process of their own multiplication may cause tissue damage, right? And the more tissue damage they cause, the more we lose the function of that particular organ, and then we get sick and we get disease. Many a time our immune system fights it off and we are okay. Now, the ability, as we were discussing yesterday about pathogenicity and virulence. So a bacteria which is virulent, which means it has enhanced capability to cause damage, to cause tissue dysfunction, to cause disease, okay? But these are factors, and these factors are coming from the genetic traits that these bacteria have. So they kind of acquired it. For example, if I was to tell you, let me get this down, Mycobacterium smegmatis. This is a mycobacterium. This is there in the male penis, in the smegma, but it is normal for male penises to have that, Mycobacterium smegmatis, as compared to Mycobacterium tuberculosis, which is going to cause tuberculosis. They both have the same species, but one of them is okay. The other one is very dangerous. So I will say one has more virulent factor than the other one, which will take normal, because it's not going to cause much of a damage. It just happens to be there. Okay, and so on and so forth. The ability of these bacteria to cause disease is basically it determines the virulence factors, and in the process of them entering into the system, our system, they have developed those factors that we will discuss today. All those factors put together, if I was to say, okay, there are 20 factors, so any bacteria which has all 20 is more virulent as compared to bacteria which has 10, right? So the virulence is proportional to the amount of virulence factors do they have. Okay, does that make sense? Now, these are some of the generic bacterial virulence mechanism, and it's very simple to understand. I mean, if the moment you start thinking it, why do we wash our hands, for example? Because the bacteria is there, we want to wash away the bacteria. But let's say the bacteria is sticky, it's going to adhere to our hands. The chances is it's going to be dangerous, it's more virulent. Okay, so the very first thing they want to do is adhere to our bodies. And once they adhere, they're going to invade, go in. So all these are terms that we use. And once they go in, they're going to divide, right? If you give them the proper nutrition. And in the division, they will produce acids and gases. You know, I'm sick, I'm bloating. You know, I'm sick, I've got acid because of the bacteria producing an acid. Okay? And then again, they have this. Now, if some bacteria has to enter the skin, bacteria has to release toxins to break the skin. If some bacteria has to enter the lung, bacteria has to release products to break the lining of the lungs. So they have enzymes. They come with enzyme, degradative enzymes. They have to break the proteins in our body, in our skin, on our tissue, cytotoxin protein. They release some of the toxin, as I said earlier, we call exotoxin, and some of the bacteria have a toxin which is attached to them. We call endotoxin. Okay? They may fool our system to present as a super antigen. This is how, and they sometimes induce excess inflammation. They do that. It helps them, we'll explain. And then again, they may evade phagocytic and immune clearance. Okay, this is also a virulence factor. Some of the bacteria have a capsule, so that's protective. So our acids cannot break it. You know, the fatty acids on the skin, the acid of the stomach is designed to break apart most of the bacteria, right? So that's why if you're taking too much antacids, so you are making yourself vulnerable to bacteria because you are removing the acid environment in the stomach that could have killed the bacteria. Okay? If you're drinking raw milk and don't boil it, so you are allowing the bacteria to get into it because many of bacteria will be removed by a process of pasteurization, for example. That's what we do for most of the milk which is supplied in this country. As compared to some other parts, they will just kind of take raw milk. Okay? So these are some of the factors. Then again, they may be resistant to antibiotics, and then sometimes they go and disappear in our cells and grow within our cells, and our immune system would never know what is happening. So all of these are the virulence factors that many bacteria have as we go, because these are like journal microbiology lectures. I'm just giving you a upshot of most of the bacteria. Once we go in detail for individual bacteria, you must have done it in your PowerPoint presentations. You'll say, hey, one of these bacteria, for example, has a intracellular growth. Then you say, okay, intracellular growth. This means the bacteria can grow extracellular as well. Yes. So any bacteria which will be extracellular growth is going to be exposed to antibodies as compared to intracellular because antibodies cannot reach there. Things of that nature. So all these are mechanisms. So when you talk of your bacteria, you want to tell me the story, why this particular bacteria, how does it get into the system? That's the story for pathogenesis of either all of them, one of them, or some of them. Okay. If I was to ask you, for example, a question, what are the primary virulence factors of bacteria? It's a general question. And again, I put all those things that are in the previous slide. I say, hey, they have a capsule, they have adhesions. So what happens is that I just said the word verb, adhesion, right? But so that's the process. But if you go a little bit detailed, this is protein you call adhesins, right? If I say they have the ability to invade, there's going to be enzymes which are invasins, so it's going to help you to remember. But that's what most of the microbiologists do, and then so on and so forth, right? So answer for this one is all of the above, because they all are virulence factors of bacteria. Okay. Okay. Now the question will be: bacteria may have always more than one or only one. What do you think? Most of the bacteria, even if most of the bacteria, if they're going to use the best tool that they have, right? And that's what we are going to be after, right? Because we cannot deal with all these 20, 30 things. We're going to go and find out, okay, well, this bacteria has such and such and such, but what is the one that's going to cause maximum damage? We're going to go after that, and because that's what we normally do, okay? So then most of the time we ask this question, give an example of bacteria having many virulence factors. Remember that most of them will have only one, right? As compared to any bacteria which we have more than one. So what we will say, these are more virulent. They are highly pathogenic. They are highly dangerous. They are a big problem, same term, right? Like, for example, E. coli, Clostridium, Corynebacterium diphtheria, and Staphylococcus aureus. So these are some of the examples of bacteria. They have more virulence factor. And remember, any bacteria which is the more virulent factor is going to cause more disease, more damage, more problem, and more difficulty for us. Okay? Now, if you go in detail, if you were to compare these three bacteria, right? Those of you, for example, who's presented for the Staph aureus? Who's got Staph aureus? Who has presentation for Staph aureus? Okay, not here. So you can see Staph aureus. This is going to be the first bacteria I'm going to discuss. It's a gram-positive bacteria, and you see how much virulence factor it has as compared to Corynebacterium diphtheria. So it's easy for us to just target one as compared to this particular, because it has ability to attach, ability to degrade, toxin, catalase, coagulase, and so on and so forth. So we have a big challenge when we deal for Staphylococcus aureus. Now, another question can be asked: can different strains with the bacteria especially express different virulence mechanisms? Yes, because E. coli invasion and bloody stools are cholera-like. So what happens is E. coli, different strains of E. coli will have different ability. So that's what we divide within the one family different strain. For example, if you remember the lining of intestine, any bacteria which will line to intestine only will call diarrhea. If it goes more penetrate, it's going to hit the blood vessel. So you have bloody diarrhea then. So the invasiveness of E. coli will determine the disease. Some of the strains will carry more virulence factor, right, because of the strain difference. So we actually make sure that we know what's going on in terms of a person just having a watery stool, because this bacteria just attaches to your intestine, as compared to a bacteria that's going to go and penetrate into the deeper part of your intestine and hit the vessels. So you will have then bloody diarrhea. Okay, so E. coli with bloody diarrhea, of course, is dangerous. It tells you the invasiveness of that particular bacteria. Just an example. Okay. Now, having said that, as I said, some of the good bacteria, bad bacteria, those bacteria which are part of our bodies, we call them normal flora. You cannot get rid of that bacteria, no matter how, super hygienic or what, and it's not advisable as well. Okay, that's the lecture I gave last time, but I'm going to give it later for your class. So this is mostly those bacteria that should not cause disease, but there's a catch over here. They don't cause a disease if they don't have an opportunity to get into us. So we have a normal, each one of us has normal flora. So we can categorize that in terms of, for example, a baby comes and the baby has ear infection. So before you go and look and swab that to find out what bacteria is, you will need to know what is the normal flora present here. So there are normal bacteria sitting over there. Okay? So all our openings of the body, eyes have normal flora, mouth has normal flora, ear has normal flora, urethra has normal flora, vagina has normal flora, rectum, you name it, axilla has normal flora. Each and every part of our body has set of bacteria which we call protective bacteria. Right? And that's the biggest research these days. Right? So what happens is if you give too much of antibiotics, so you remove your friends, which are bacteria. And when you remove those friends, those parts will be taken up by your enemies, pathogenic bacteria. Okay, so that's the whole idea. So the human body is colonized, we call normal flora. They are very important. We need them for digestion of foods. They produce vitamins like vitamin K. They can protect the host from colonization with pathogenic microbes. This is like, if there are 100 seats over here, they're all occupied. The moment one is vacant, another will try to fill in, and that may be enemy in terms of pathogenicity. Okay? And then again, as I said earlier, these are also called endogenous bacteria because they are your bacteria. Now we can, if I was to take, if you were to take swab of your eyes, for example, and plate it over here, so we may get like 20 bacteria, which may be common for most of us. But there will be some bacteria which are very special to us. Right? So we need to know and find out if there is a bacteria which should not be normally present over there. Right? For example, I'm going to talk about that when I talk about sexual transmissible diseases, like vaginal pH, that's acid. So acid pH of vagina is basically protective. Because if it's not acidic pH, then we'll have problems. So that acidic pH is coming from the normal vaginal flora. If you remove that, then you have a problem. We cannot remove that. That makes sense? So these are some of the normalities we have. So the only time the normal flora can cause problem is they are used to sitting outside of our body. But if there's a cut, if they go into the body, then they are not your friends. Then they change. We call such a process as opportunistic infection. When they're your friends, as long as you don't give them opportunity to go in. Once you open the door for them, they are no longer your friends. So that's another thing that you have to understand in terms of normal flora. Okay? And again, I'm going to talk about that. And I think last year I gave exercise. So what I would do is that you should at least, I would say, remember the most important bacteria of a particular site. Right? I just gave you an example from Mycobacterium smegmatis, which is a normal mycobacterium present in the smegma of the male penis. In this case, if you do a swab for STD, if person comes and you say, oh, mycobacterium, that doesn't suggest tuberculosis. It may take acid fast stain, but that's a normal habitat. As compared to Neisseria, if you pick up Neisseria over there, Neisseria is not normal over there. If you have an Neisseria, it's an STD. It is not supposed to be there. And we can trace the history on all these kind of things. Okay? So virulent bacteria have those processes. I talk about the opportunistic bacteria that, okay. These bacteria which are outside your normal body, and I give you one of the example, how can they get in? One was cut. The other thing is your immune system is stopping them to enter. If you're immunosuppressed, then again, you give them an opportunity to come and play with you. Okay? If a person is like burned and the skin barrier is lost, Pseudomonas aeruginosa will be the major problem because it tends, okay. Why do you think, I mean, just like a common sense question, why do you think, what is special about Pseudomonas aeruginosa, without even knowing what that bacteria is, that it loves to grow on dead tissue? Because burnt tissue is dead tissue. What do you think? What could be special about this bacteria? Huh? Remember, I said some of the bacteria are aerobes. They love oxygen. Some of the bacteria don't want oxygen. They want to go for dead tissue. Anaerobes. Is that? So that, again, will click in your mind, is a good reason for them to be there and for others not to be there. And we use that as therapy as well. So we give oxygen to kill bacteria as well. Keep that in mind. Okay? And then again, I'll just give you an example of AIDS patient where immune system is suppressed. And does anybody remember the name of any other mycobacterium that I said causes problem in AIDS patient? Louder. Mycobacterium avium. This is a mycobacterium that's, even if you have immune system of a bird, right, you should be good enough to protect. But the AIDS patient do not have even an immune system of a bird. They get infected with a bacteria that causes disease in bird, Mycobacterium avium. Sometimes they have Mycobacterium avium intracellulare, Mycobacterium avium complex. Okay, so you can see just by the word Mycobacterium, which is a larger family, you should not immediately jump to like, for example, tuberculosis. Mycobacterium leprae, leprosy, right? So these should not be present on you at any time. But if you have avium and these normal, that's fine. Your immune system is going to have to fight that. The challenge for this bacteria is, if they're on your body, fair enough, you have good immune system, you take care of your hygiene, and there are some other factors I'll discuss in that lecture. But their problem is that they want to enter our bodies. And that's the beginning of the disease process, right? The good thing is the moment they enter our body immune system is designed is going to ring a bell. It's like a fire alarm. The moment you break the barrier, immune system will kick in. They have a very strong immune response because of the surface of bacteria, right? It leads to, again, immunology is going to come, acute phase reactants, interleukin 1, interleukin 6, tumor necrosis rate. The moment your immune system sees a capsule, it's going to shoot an alarm and kick in cytokines to activate the whole immune system. And these are the major players. Okay? But also remember that most of the time our host response is protective to protect you. But sometimes it's over and above normal. So it's like a friendly fire. So cytokines are good, but if they're not controlled, they are going to have a storm, perfect storm, and you will go through sepsis, okay? So how do we get disease? We get disease, infection, when bacteria get into us, and we don't have a well-organized, orchestrated immune system to do a clean job, right? So in the process where our innate immune system, adaptive immune system, fighting off that infection, things get out of control, right? And bacteria wins. Then we have to go and help those immune system to go for that, okay? Now, the disease production per se is coming from the enzymes, the toxins, and many other things which are bacteria related, number one. The disease is also coming from your immune system going out of control, both. You know, it's like I said, a friendly fire situation. So damage caused by the bacteria plus the consequence of innate and immune response to infection. So it's like a battlefront. It's a crime scene there where bacteria wants to get over here and everything comes up here, a lot of killing taking place, innate cells, immune cells, all this fighting up. And in the process, if your immune system is not good and strong enough, it's going to kill bacteria, it's going to kill your tissue as well. Like allergies, we talked about that. So the signs and symptoms of a particular disease depends upon where is this entry site of that bacteria, for example. If the bacteria has entered your lungs, so you have a problem in the lungs. You'll cough, you'll throw blood. If the bacteria wants to enter intestine, you have diarrhea. If the bacteria wants to enter your skin, you have a boil. Does that make sense? So you can see from here. The other important thing is that bacteria may go through incubation period. Remember incubation period, latent periods? Some of the bacteria are waiting for the perfect moment to come out and cause damage. They're clever. A person, for example, I'll teach that in STD, happens to have an intercourse with an STD positive partner, for example. Or let me put it, HIV positive. And so he or she is expecting I'm going to get HIV next day, not necessarily. HIV virus can wait 10 years in your body to cause problem. So that's the incubation period. That varies from bacteria to bacteria. Does that make sense? So that's what we are talking about in terms of response. Sometimes a bacteria, while you were there, wherever you were, your mother or your sibling had a TB, and you got infected, and it's been 30 years, you're okay, you get old, and that one mycobacterium which was hiding in one of your cells now decides to come back and cause infection. So that time point when the bacteria hibernates, is called incubation period, right? And sometimes bacteria would also wait and divide to a particular number before they go. They built up an army before they invade. They keep on dividing till they have this required army, a required number of bacteria to cause maximum damage. So that's what happens in terms of disease production. Okay. Now, as I said earlier, human bodies, so we basically are protected by skin. So you have skin lining and mucosa. So we have openings in our body, and these openings are the favorite places of bacteria to enter. Okay, as I said earlier, most of these openings, whether they are open like a mouth to anal canal, urogenital, whatever the openings are there, they are lined by normal bacteria, normal commensal. So the bacteria fight against bacteria. That's protected. So you don't have to do anything. Most of our infections are stopped by our own body bacteria. Okay, so that will give you another theory we call super hygiene theory, is that if you think, hey, I'm going to wash every part of my body, this is dangerous. No. Because what you're doing now is you're going above and beyond the norm, and you may have a problem there. Okay? So if you have a scratch or injury, or even a mosquito bite, so it's going to allow that barrier to pass. Right? Also keep in mind, like alimentary canal, which is, so any bacteria which is over there still may be technically within us, but not within us unless it penetrates the tissues. So none of us can obviously be ever sterile. The only sterile person is a newborn baby. Right? The moment the baby is born, and especially for vaginal delivery, the very first bacteria the baby is going to get is from the mother's vaginal canal. And that is good for the baby. Right? Because her immune system needs to be educated. So that's like a friendly kind of a bacteria. And I'll discuss that in detail why that is. But keep in mind that you don't want to get rid of friendly bacteria because they are protective. Okay? And then again, things can go wrong. Now, if you look at your book, it kind of summarizes tables. And that's now cramming part. There's no understanding on that. I mean, you can make your own mnemonic. The routes of the bacteria getting into the body, we can either eat bacteria in the food, and these are the bacteria that we eat. So I would want you to know what are the bacteria. The other term for these is our food-borne pathogens. So these bacteria we should be looking up for food. So FDA has to make sure that all your sandwiches and all your food are properly regulated for the absence of this bacteria. So these are bacteria that cause problem because we ingest them. We can also inhale bacteria. So that's another route. So these are the bacteria that we inhale. Right? If I was to ask you, what are the bacteria causes pneumonia? These are the bacteria cause pneumonia because you inhale them. Right? If I tell you, what bacteria are you worried about if you have a roadside accident or trauma? Clostridium tetani. It's only one. If you have a needle stick injury, I'm not talking about viruses, what bacteria may cause problem? Staphylococcus aureus, Pseudomonas. Sometimes insects, and I was reading one of your PowerPoints, whosoever was writing for lice. Lice, how can lice cause fatal disease? And lice, pediculosis is also an STD. So what happens is that the lice have the ability to take bacteria from one person and inject it to the other person. We call arthropod. So this is a arthropod bite of different small insects like lices, mosquitoes, and so on and so forth. They cause tons of infection, even plague, the notorious plague. You can see plague over here. And some of the bacteria are notorious for sexually transmitted. So the moment person walks into STD clinic, so we're going to test for Neisseria gonorrhea, we're going to test for Chlamydia trachomatis, we're going to test for Treponema pallidum. 3 important bacterial infection that has a very high incidence, especially Chlamydia trachomatis, and especially in women. We'll discuss that in detail. So you need to know what are the bacteria you are looking for in terms of causing disease in a particular organ. That makes sense? And of course, when we'll discuss these bacteria in detail, we'll also talk about why is it they want to go. One of the obvious reasons is that they're all aerobes, simple. One of the obvious reasons for Clostridium tetani to be trauma is an anaerobe, because it wants to grow in dead tissue. Okay? So things of that nature. Now, once they come into us, they tend to colonize, adhere, and invade. So that's the process many of bacteria have. Okay? Now, if you look at, for example, examples of the mechanisms which these bacteria have in terms of adherence, and remember now, a little of immunology, a little of micro, that these bacteria are going to come with a receptor which is going to adhere, and our bodies are going to give them the receptor. And our problem is that we want to stop that by giving drugs. So we want to nip the evil in the bud. We want to stop bacterial adherence, right? So if you go over here, you see, for example, Streptococcus aureus and staph, they have this adhesion we call LTA, slime, right? And they attach to some of the receptors that we know of, and some of the receptors are unknown to us. We're still investigating. So we want to stop that, okay? So you can see most of the adhesions are a very particular type of a protein or a very particular type of a receptor which actually binds to another receptor. So bacteria come with one receptor and our bodies come up with another receptor. So what it means is, why Neisseria gonorrhea is going to go to hit urethra, for example, sexual transmitted diseases? It carries a receptor, and corresponding receptor is present in the epithelium of urethra. That's the reason. Why some bacteria is notorious to cause infection of the brain? Because it carries a receptor, and the corresponding receptor is there on the body. Okay, and you can see some of them are common, like fibronectin, and some are gangliosides, and some are like you can see fucose and mannose for Vibrio cholera. So all of these present a particular protein or receptor which is going to bind to the other one. And this is just general. Now, what are the consequences of the action of pathogenesis of bacteria? So they're going to cause tissue destruction, toxin. As I said, definition of exotoxin is produced by the bacteria release as compared to endotoxin, which are lipopolysaccharides and the other cell wall components that are released. Okay, old slide. I think we discussed that in the receptor physiology as well. So you can see from here, for example, is Corynea diphtheria, right? You see from here, yeah. So you can see this has a receptor, or it has a protein part. It's going to release a toxin which has components A and B, and these toxins called diphtheria toxin is going to go and attach to the corresponding cell, right? So this will suggest to you one bacteria, even being ingested, can go and cross different parts of the body and have specific attachment because that's what the receptor is for. Okay. The other important over here, you can see from here, like cholera. So cholera is going to release a toxin, and this toxin is going to bind to a receptor on our intestine, right? So that's the pathogenesis of cholera, and you can see that this is a gangliocyte receptor. The moment it's going to bind over there, it's going to cause release of cyclic CMP activity, which is going to increase the secretion. The cyclic AMP level go up, right, and it causes disturbance of electrolyte balance. So cholera will cause problem because of loss of electrolytes. So you can see all those channels will be opened by the adenylate cyclase activity, which will increase EMP, and you lose all the electrolytes. So in cholera, we are not interested in basically killing the cholera immediately. We are more interested in compensating for the loss of electrolyte, which is the major pathogenic mechanism in this particular case. And then again, for example, Clostridium is a roadside accident. It's going to release a toxin which is called tetanospasmin. Tetanospasmin is going to attach to the neurotransmitter, and it's going to cause tetany. So that's the pathogenic mechanism. So do you remember that why do we need to know pathogenic mechanism? Because the mere use of antibiotic is not enough to treat the symptoms of the disease. So we have to give another shot at those antitoxins that are there. Okay, I wouldn't spend much time immunopathogenesis because we already had 20 lectures, and you pretty much can put things together. That what do we mean by immunopathogenesis? But I'm just going to run through them. We talked about superantigens, and the superantigens you can see from here. This is a normal process for antigen presentation, where you have a T cell talking to antigen presenting cell, and you have to have a antigen over here. But as I said, the short circuit, the bacteria can release the super antigen and bypass the system, and then get a immune system which will be out of control. Okay, this is how a super antigen looks like. It's going to bind, short circuit without a antigen in between, and cause damage. So it's many other bacteria either act as super antigen or release super antigen. Okay, remember when we were talking about the cell wall of gram-negative, right? And I said the most important thing, and I asked you the question as well, the most important stimulator immune system is LPS. It's called endotoxin as well, so that's dangerous. So once you have endotoxin released by bacteria, so you can have fever, all these things are going to come eventually death, because all your immune system is activated without control by bacteria. So it's going to take out the weapons that you have for your protection and go against you. So that's the cytotoxicity that we have in terms of endotoxin. Okay, and you can see this picture. Repeat from the immunology. So you have LPS over here. This is present bacteria. Is going to call in all those things of innate and adaptive immune response, leading to shock and death, because everything is out of control. Okay. Now, we also talked about how does bacteria escape our host defenses, and we discussed that also in immunology. So those bacteria which have a capsule, of course, have better chances, we call the ability of these bacteria to avoid immunologic clearance is that if they are capsulated, Their antigens look like our human antigen, we call antigen mimicry. So our immune system say, hey, this is us, no worry. So they can mask their antigen, we call antigen masking. They can shift their antigen, don't show all this antigen. They can themselves produce enzyme, they're going to chew our antibodies. So you're gonna throw antibodies at them and they're gonna, have those enzymes, they're gonna digest them. So you can say proteases. They can, phagocytes should kill them, but they can also kill phagocytes because they have toxins. Okay? They will stop chemotaxis. So all those things which are required for us to mount a response, they carry all those materials to make them null and void. And remember, even to such an extent that they can even inhibit phagolysosome fusion. So it gives you a general kind of plan on terms of bacteria to avoid it. But once we go very specific, we're going to tell you exactly what is the enzyme used for that, what is the mechanism. That's what immunopathogen. That's what I want you to talk about when you talk about pathogenesis of a particular bacteria. You can see from here, resistant to lysosomal enzymes. So they have all those, whatever you have, they have an antidote for that. So that's a problem for us. So you can see use of antibiotics may not be enough. So these are those microorganisms which have a capsule. So you see the list of microorganisms, they all have a capsule. So they're called capsulated microorganism. So they're going to fool us around. So they're very protective covering. Some of the pathogens, I gave you example of Mycobacterium, they hide in our own cells and they have intracellular growth. And we talked about that, what it is advantageous for them. And notorious is Mycobacterium, Brucella, Francisella, and so on and so forth. So these are very difficult for us to treat. They go into the system, hide, hibernate, and there's nothing you can do because T cells and B cells have to see exterior. If nothing is presented, they will not let it present. They're going to sit over there, wait for the perfect time to come up and cause problem. So we call, these are the examples, or we call them intracellular pathogens. Now, if I was to ask you, and I did ask you when we were talking about that, what are those particular bacteria that are notorious in terms of inhibition of phagolysosome fusion? Remember, we talked about that in the exam as well. So the most important is Legionella, Mycobacterium tuberculosis, and Chlamydia. What are the bacteria which are resistant to lysosome enzymes? So we pretty much know the mechanism of those particular bacteria in terms of causing pathogenesis. So we need to come up with a plan or strategy to not let them use that particular virulence factor. Okay, so if I was to ask you some question, I'm going to ask you, what do you think? Name the bacteria which basically are resistant to lysosomal enzyme. I'm going to give you all these bacteria. So these are some of the cramming material that you need to remember in terms of the three important aspects for bacterial pathogenesis. And I'll stop here and take some questions if you have any for me related to the